Welcome to this week's edition of the Medical Center Show. Today we have a great guest, Dr. Len Resnikoff, who is the director of our medical breast imaging. Our show brings you healthy information about how to keep yourself healthy in Hudson County.
Jersey City Medical Center, Hudson County's #1 hospital, as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org. It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Welcome back to the Medical Center Show. Today we have with us Dr. Len Resnikoff, who is our medical director of breast imaging at the Christy Kerr Women's Center. Welcome, Dr. Resnikoff.
Thank you, Joe.
Tell us a little bit about yourself.
Well, I'm a breast imager with the University Radiology Group, and my specialty is, as you said, breast imaging. And what we do in our group, which is a large practice, enables us to specialize solely into the area of our expertise, which for me is all facets of breast imaging.
Wow. So you are specifically trained in breast imaging. Tell us a little about your training and education. Where did you go to medical school?
Okay, I went to Chicago Medical School and then did my diagnostic radiology residency at the Bronx Lebanon Hospital.
Okay, in New York.
In New York, and then went to do a fellowship in breast imaging at Western Pennsylvania Hospital with my mentor, Ellen Mendelsohn.
Okay. So you were trained first as a radiologist. You can read films like all the other radiologists, but then you did this specialized fellowship in breast imaging. So how many people do that kind of fellowship? I mean, there can't be a lot of doctors out there that have that kind of expertise, right?
Right. Well, 20 or so years ago, when I went into breast imaging, one of the reasons I did is that there was a lack of specialized breast imagers in the country.
Okay.
It was a developing field at the time, and basically there aren't that many people who went into it back then. It's become a lot more popular in the last several years as the new modalities in breast imaging have come around, and there's been a big drive to do good quality breast imaging.
Breast imaging.
Yeah.
So the specialized training that you had, how long did it take? How long is a fellowship in breast imaging?
Well, it's a 1-year fellowship after the 4-year residency.
All right.
And,
so you spend a whole year really specifically focused just on images of the breast and the diagnosis and treatment of patients with breast cancer?
Yes, a full year in breast, in mammography, breast ultrasound, breast MRI.
Okay, so it's not just mammography, so it includes ultrasound and the MRI. So let's talk a little bit about the Christy Kerr Women's Center. Tell us a little bit about the Women's Center, what kind of equipment they have. Tell us a little bit about why the Christy Kerr Women's Center is important for women's health.
Okay, so the Christy Kerr Women's Center, which is part of Jersey City Medical Center, and the great thing about it is it's dedicated to breast care for the women in New Jersey. And we work very closely, the radiologists, with the breast surgeons and with the other clinicians in order to deliver really good, high-quality patient care at the center. Sometimes the whole workup can be done in the same day, and which is really nice.
So that's really convenient for women. So someone comes to the center, state-of-the-art equipment, the mammography machines. Tell us a little bit about those.
Yes, we have digital mammography, which is very important. State-of-the-art now, came around about 8-10 years ago, and now it's really become the standard of care in breast imaging. It delivers high-quality images. And
so are there places where they may not have digital imaging?
There are still places in New Jersey and in other parts of the country that are still film screen analog breast imaging.
Wow.
It's becoming less and less, but they are.
And the advantage of digital?
Well, digital mammography allows you to see certain areas of the breast better, the axilla, the skin regions.
Okay.
And in general, it's
Tell the audience what the axilla is.
the area under the arm, which is further back in the breast, posterior, as we like to say, and the skin area also anterior, as we was a hard area to see with film screen mammography.
Okay.
It's also enables us to easily compare on the computer, to store on the computer. It's easier, very much easier on the eyes of the radiologist. Allows us to look harder and not get that eyewear that we used to get.
Right.
It's all around just a better test.
So the technology now allows you to take a digital image, kind of like what happens with your cell phone, taking a picture of your cell phone, right? So it's all digital. There's no more film that you're throwing up on a screen. It's all through the computer now.
Right. It's all on the computer. And the images are stored in the computer. We don't have to worry about losing films anymore. And really, where it shines, digital imaging is in the breast is with women with very dense breast tissue, tend to be younger,
right.
At a risk of certainly of developing breast cancer, and usually with younger women, aggressive breast cancers. And certainly, the digital films allow us to look really at a good picture of these dense breasts and possibly maneuver with the windowing. And get better films.
Now, I think that we also have something called an image checker, right? Isn't there some technology that allows you to kind of look at these films in different ways?
Right. There's what we call computer-aided diagnosis. It comes along with the digital image, and we'll put a marker on an area that the computer feels is suspicious, which is good because, when we do read, it's always easy to miss something, and the computer will mark an area and draws our eye to it.
It draws your eye to it, and
Right.
then you're able to look more closely at whether or not that's an area of concern.
Right, and another facet of the care we give at Christie Kerr is we double read the mammograms. We have 2 radiologists reading these screening mammograms, and 4 eyes are better than 2.
Sure.
They're done independently. One doctor does not know what the other doctor read, and it cuts down on any possible misses that might occur.
Okay, so just to kind of recap a little bit, at the Christie Kerr Women's Center, we have state-of-the-art digital mammography. We have specialized doctors who have gone to specialized training to read that, and we've got all the equipment that really can do the best to diagnose and treat any type of breast cancer that might be found through mammography screening.
Right, and that's inclusive of the breast ultrasound, breast MRI, and the interventional breast procedures, either stereotactically, under ultrasound guidance, or under MRI guidance.
Okay, great. So most women have mammography screening. What's the recommendation these days for getting screenings?
Okay, so the current recommendations, and it's always a little controversial, they're changing and different societies disagree, but the most of the societies still recommend a screening baseline at age 40 and yearly afterwards. Other societies recommend every other year starting at age 40. We still recommend yearly. We think that's very important.
Right.
And
so every year women should get it. And they should go to a center that has state-of-the-art, like the Christie Kerr Women's Center.
Yeah, it behooves a woman to get the best care they can, and to breast imaging obviously is very important for their overall health.
Right.
And if you were to go somewhere, Christie Kerr would be a place to get excellent care.
Okay, great. We'll be right back with Dr. Len Resnikoff, talk more about breast imaging.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just 1 path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Welcome back to the Medical Center Show. We're here with Dr. Len Resnikoff, who is our medical director at the Christy Carr Women's Center for breast imaging. So we talked a little bit about screening for women. Our recommendation these days is women over the age 40 get an annual screening.
Correct.
Tell us a little bit about, because I'm sure psychologically it's very disturbing to women to get that call that we think something's suspicious after you have a mammography. Tell us, how do we go about doing that? What's the best way for women to react to something like that? Because I know sometimes we hear from women that, oh, I got this letter, I'm not really sure what's going on. Tell us a little bit about that.
Well, after a screening mammogram, a certain percentage of women will get called back.
Okay.
And it is extremely
So what percentage?
anxiety-provoking. Well, it differs from place to place, but let's say the average is around between 10 and 15% or
Okay.
so.
All right.
It's very anxiety-provoking
Sure.
for the patient, as is the screening mammogram in general.
Sure.
And but most women should realize that it's a very few of the callbacks that are actually due to breast cancer. A lot of them are just we want to look a little bit better at certain parts of the breast tissue.
Oh, I see. So 10 to 15%, you find something that you say, we need to look at that more closely. Notify the women. They have to come back.
Right.
Of that 10 to 15%, how many actually end up having something that you are concerned about?
Well, out of that 10-15%, we'll probably biopsy or we'll probably work up and perform a biopsy maybe on those, maybe 10%.
10%. So really, you're talking about 1 to 1.5% of the women who get a mammography screening really end up having something more invasive than just some kind of diagnostic testing.
Right. On the national average, it's, breast cancers are about 6 out of 1,000 screeners.
Okay.
That number, differs on the age of the population and various other factors. But most of the breast disease we see is benign.
Right.
And still there's a far greater chance for when a woman comes in for a workup that everything is going to be fine.
Oh, great. Okay, good. So people shouldn't panic when they get that notice to come back. We just want to check it out and make sure that nothing's going wrong.
Right, as hard as it is.
Yeah, I'm sure do we get them in pretty quickly after we send them a notice like that? I mean, imagine everybody wants to come running right back and have the next test done.
Yes, we try to get them in, hopefully within the next week.
Okay, good.
And try to allay their fears as soon as possible.
Now, so they've had their mammography, something might be suspicious. Do we go right to doing a biopsy, or are there other things that we might do prior to, like ultrasound? You talked about an MRI. When are they appropriate?
Okay, so when we find calcifications, those will be worked up mammographically.
Okay.
And if they're suspicious, go on to a stereotactic biopsy.
All right.
If we see a mass nodule density that is suspicious, or not suspicious, just to confirm that it may be benign,
right.
We'll take them to ultrasound.
Okay.
And ultrasound is very important because it's an operator-dependent modality. We're scanning using sound waves, non-radiation. And you need a well-trained breast imager to look at those images and decide what is actually real, what's not real, what's suspicious, what's not suspicious.
So let's talk about that for a minute. So ultrasound is just sound waves. Someone takes a wand and so there's no radiation involved with that.
No radiation. Yes, we use a sound transducer.
Right.
And
we have specially trained ultrasound technicians who do just breast?
Yes, our ultrasound technologists do mostly breast. They do other things, but they do the ones in the imaging center specialize in the breast.
Okay.
And that's 90% of their work.
Right. Wow, that's amazing. So when you get the results of the ultrasound, you then read those results?
Right. We will interpret the ultrasound. We'll often scan ourselves. Like I said, it's an operator-dependent modality,
right.
So you need the doctor.
So you might
to
actually go in the room.
Yeah.
If the ultrasound technician says, this looks suspicious, they'll ask you to come in and take a look at it.
I'll actually go in on every breast ultrasound.
Oh, you will?
Yes.
Okay. Wow, that's amazing. And then you've got the specialized training through your fellowship to be able to really identify those
Right.
things.
It's a real-time exam. I need to see the images myself in real time to see exactly what's going on.
Okay. And then when do we use the MRI? Because don't we have a special equipment that we've outfitted our MRI to be able to do breast imaging through the MRI, right?
Right. We have a dedicated breast coil.
Okay.
And breast MRI we typically use, which are under fairly strict guidelines, probably most often on women with known biopsy-proven cancer to look to make sure there's no other disease either in that breast or the other breast prior to her definitive surgery and
okay.
therapy.
All right.
The other uses are for the initial use going way back when was for the evaluation of the integrity of a breast implant.
Oh, I see.
And now we use also for high-risk patients, patients who are, have the positive for the breast mutation genes,
Right.
and other women at high risk in combination either with strong family history, biopsies in the breast in the past, and extremely dense breast tissue, possibly as well in combination with that. We will put a certain amount of people into a screening breast MRI program if
Okay.
they are high risk.
Right. So, and in the Christie Carr Women's Center, we've got the mammography, we have ultrasound, and we have the MRI with that specialized equipment. So everything's right there.
Yes, everything is right here, and there's also we work very closely with a breast surgeon, Dr. Julie DeGioia, who is dedicated to breast care,
Right.
And we'll communicate on a daily basis about the patients and
Right.
about the workup.
Okay. So everybody kind of gets a little squeamish when they have to go into an MRI. Tell us a little about the equipment at the medical center. It's not that kind of torpedo thing anymore, right? It's
Right.
We've got relatively new equipment, and it's state of the art.
Yes, it's new. It's very state of the art, and the magnets are the MRIs are different than 10, 15 years ago. The tubes are a lot more open.
Okay. So it's not like you feel as claustrophobic maybe as going into a tube like the old MRIs,
Right.
right?
It's right. It's not nearly as claustrophobic, and although not being completely open, it's just a wider, bigger tube,
Right.
and allows just a little bit more comfort than it used to.
Do we give people some medicine if they're really squeamish about going in there? Do we ever?
Yes, we sometimes, and there are a lot of people who don't like that claustrophobic feel.
Yeah.
They can get a little bit of an anti-anxiety.
Oh, they do.
medicine,
Okay, so we
given
try to
by their
make
doctor.
it as comfortable as possible for them.
Correct.
Yeah. The images that we get. So, how do you read those images? I mean, is it slices like a CT scan, or is it just a? Tell us a little bit about the images you get from the MRI.
Okay, so the most important part of the MRI is we give an injection of gadolinium, which is the contrast dye,
Okay.
contrast agent for MRI.
Right.
And what we do is we take different sequences, and the most important sequences are when we subtract out what actually is enhancing with the contrast, because those are the vascular areas from the rest of the breast.
Okay.
And we see up to 500 to 1,000 images of the breasts, and go in very fine detail into.
Wow, 500 to 1,000 images. Wow, how do you look at all those?
It takes time. And,
Takes time.
But you eventually, with experience, like everything else, you train your eye to find what you need to find.
Oh, great. Okay, we'll be right back with Dr. Lynn Resnikoff.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back to the Medical Center Show. We're here with Dr. Resnikoff. We're talking about breast imaging. Dr. Resnikoff has specialized training and a fellowship in breast imaging, and so we're really happy to have you on our staff, and does great work in helping women who for mammography screening and screening for breast cancer. So we were talking a little bit about the MRI. And you said that you get thousands of pictures that you have to kind of look at. Again, they're all digital, and so it's all on the computer. Nobody's walking home with these big films anymore, right?
Right, it's all computer-based, and as much of radiology is now.
Right, and so you have to go through all these different images to see if anything's there. You talked about the patients who are candidates for a breast MRI. A tedious job, but something that you're especially trained to do.
It's a hard job. You know, breast imaging you can characterize in general as a somewhat tedious affair.
Right.
It's, you need to have patience. You need to
have specialized training.
Specialized training.
Sure.
You need to have the ability to sit down and really try to analyze every picture as if it was the last picture you were going to read, because we don't want to miss anything.
Right.
And we try very hard not to miss anything, and we really analyze each, whether it's the mammogram, the breast ultrasound, or the breast MRI, like it was a family member.
Right. One of the things that doesn't really involve imaging is the stereotactic biopsy. And we recently just purchased a new piece of equipment for the Christy Kerr Women's Center where we're at stereotactic biopsy machine.
Right. We have a brand new stereotactic unit, also state-of-the-art, and that allows us to biopsy calcifications in the breast very non-invasively.
So it's a needle biopsy, so it's just minimally invasive.
Right. It's a.
And you don't do that. The surgeon does it?
No, the radiologist does. Surgeons do it as well. In general, the radiologists do most of the stereotactic biopsies. And what we do is we just find the area of concern, usually calcification.
So how do you find it?
Well, once we know from the mammogram approximately where it is, we target the stereotactic images towards that area.
So this machine actually has an imaging device with it?
Right. We take images at angles of 15 degrees with the stereotactic unit, and that triangulates or geometrically figures out the depth of the lesion.
Oh, I see.
And we put our needle in where we know it is.
Right.
The machine itself assists us with the depth of the lesion, and we insert a small needle into the area. Hopefully in around 5 to 10 minutes, we'll have the tissue, and the patient goes home very shortly afterwards with a Band-Aid.
Now, so just a Band-Aid, wow, that's amazing.
Well, to be technical, Steri-Strips.
Yeah, okay, Steri-Strips. But it's not a huge, you don't cut the breast open, it's just a small incision, okay. Right. So that's really state-of-the-art. That I'm sure women are gratified not to have to go through a major invasive procedure. When they have that, so do you use local anesthesia, or are they?
Yes, just a couple cc's of lidocaine, and that numbs the breast enough for us to put the needle in it and take the tissue.
So now they've got the tissue. You've taken a biopsy of what you think might be suspicious. What happens to that tissue then?
Well, the tissue will be sent to the pathology lab to get a definitive pathologic diagnosis. And women should also know that when we do these biopsies, in order to make sure we're not missing cancers, they are benign about 80 to 85% of the time.
Okay.
And it's comforting to know for.
Right. So going in, people know that just because I'm having a biopsy doesn't mean that I necessarily have breast cancer. We really need the pathologist to get
right.
that.
We try to favor on not missing. So there are a lot of benign biopsies.
Right.
And.
So, what's amazing to me, and what I don't think people realize, is especially at the medical center, we've been able to build a team of doctors that really work together to make these specialized diagnoses. So we have Dr. Julie DeGioia, who's our breast surgeon. She specializes in that and works very closely with you. We have you, who are specialized, trained in reading these images. And then we have pathologists who also work. Tell us a little bit in the event someone does have cancer, I know that we recently started something called a tumor board where we have a whole bunch of doctors come to talk about a particular. Why is that important?
Well, for many reasons, continuing medical education is always important for practicing physicians.
Right.
And in the tumor board, not only will I present the radiology aspect of the cases, but there will be a breast surgeon, there will be oncologists, the pathologists, many of the ancillary services as well, and we can all learn about each other's work and updates in their respective fields, and not be where we don't understand what the pathologist is doing.
Okay.
What the
so it's an
oncologist
opportunity
is doing.
for all the different specialists to have input into a particular treatment regimen for a patient?
Right,
Okay.
and there are also residents, medical students. It's a very nice area to talk to your colleagues about cases,
Right.
and what may concern you about certain cases in regards to maybe what they do.
Right. So again, and that's unique to the medical center. There's not many places that really have that multidisciplinary physician who are specialized in all these different areas really be able to kind of provide input into the best treatment for patients. So really, the patient's getting, 40 doctors for the price of one.
Yeah,
It's
usually teaching institutions
Right.
that have these type of conferences.
Okay.
And it is beneficial for everybody.
Right. What can we look forward to down the line in terms of future technology for the detection of breast cancer?
Well, the main thing and the big thing coming down the pike, which just gained approval recently, is what's called breast tomosynthesis.
Oh, okay.
And what this is a digital mammogram, which after taking the normal pictures will then slice these pictures in little 2 millimeter or so sections.
Wow.
And then you can almost look at it as you would as a CAT scan, where you take thin images of the breast, and it helps you take a look at that overlapping tissue that we sometimes need to call the patient back for and figure out what it is.
Okay.
And it takes little thin sections of that tissue, enabling us to look at that tissue.
Wow.
And say, well, this is not a true lesion, this is just overlap of breast tissue.
Oh, I see. And is that technology available now?
It just became available,
Okay.
and it's something that the Imaging Center is pursuing.
Great.
And hopefully in the near future.
So it's kind of like the next level of mammography that really will help us diagnose and treat any type of breast cancer that's out there.
Right, and as
It's expensive?
It's well, as with all new technology, it needs to gain reimbursement from the insurance companies, which at this point it has not.
Okay.
So the places that have gotten it, they all have their various methods of billing for it or
Okay.
not.
Okay.
And that's something which needs to be determined.
Okay, great. Well, it was a great show. Thank you, Dr. Resnikoff. We will be back next week with another guest, and this is the Medical Center Show.